We've got another question here. This is from Barbara Mills Gardner. And Barbara writes, in my opinion, we could have had a healthcare overhaul with the things people liked in it, tort reform, not being denied because of pre-existing conditions and other things. What we got instead was a bill full of hidden favors, things they just couldn't get passed in other bills. Well, that's a good point. There was a lot of things that were passed in this legislation that could not have otherwise gotten passed and kind of stuck into it. You heard about the Cornhusker thing where the state of Nebraska got some benefits from the federal government that other states didn't get. There were other, something called the Louisiana Purchase, where the Louisiana senators were given something that other people were not given, and that was to get the health care law passed, and that's just wrong. So the way in which it was passed, obviously, at least from my point of view, shows that Washington is broken. But I also think that you're right, that there could have been a lot of things done to help the healthcare system to make it better without going through this huge bureaucratic process that's in this legislation. She asks about excluding people from healthcare coverage because of pre-existing conditions. That is a problem in this country, and there are common sense ways to deal with that. And there are other proposals that were out there that I've supported that said you would set up a pool in each state to handle pre-existing conditions to help people be able to afford health care if they were denied. So there are ways to get at that, and we should get at it. Barbara also mentioned malpractice reform, and what she's talking about there is, she mentioned tort reform, I think is the way she put it, but it's basically these frivolous lawsuits that are costing our healthcare system more and more. The Congressional Budget Office, again, nonpartisan group, says that the federal government alone would save at least $54 billion by sensible reforms to these frivolous lawsuits. And of course that reduces the cost to all of us because those costs are passed on to us if we have health care insurance. And so I think there are some things that can and should be done. On this issue of frivolous lawsuits, by the way, the docs and the hospitals will tell you it's more like $200 billion that could be saved. And the reason they say that is it's not just cost to the federal government, it's cost to the whole system. Providers, hospitals, clinics, and so on tend to cost shift. So if they have big costs associated with some of these lawsuits, what they're going to do is they're going to pass those costs on to people that have health care insurance. So if you get hurt through a medical procedure, of course you should be taken care of. If you have what they call compensatory damages, of course you should be taken care of. But the question is, how do you cap some of these frivolous lawsuits? And other states have done this sensibly. California is one, Texas is one. If you simply took those kind of proposals and put them out federally, again, you'd have huge savings in our healthcare system that would help all of us to be able to afford healthcare. So I guess the bottom line is, you know, we have the opportunity to make some good changes to our healthcare system. We should do them. This was not the right approach. It's too bureaucratic, too big. It involves too many mandates and new taxes, by the way, and of course reductions in provider Medicare payments and other things to pay for it. And second is, you know, it's a system that, you know, frankly, even if it was the right healthcare system for our country, we simply can't afford it. It's too many trillions of dollars added on to the trillions of dollars of debt we're already building up for our kids and grandkids. So I appreciate all those who took time to leave your thoughts on my Facebook and Twitter pages. I hope you'll continue to contact my office and show me what your concerns are. You know, let me know, and you know, let our staff know, because we're really interested to know how this law is affecting you and what we should do instead. If you have a better idea, we're very interested in it. If you think the law is working well for you, we want to hear from you too, because for some people, they do support this legislation. I just think we can do better, and I know that there's going to be a lot of discussion here during the election campaign about what to do on health care. I hope we have an informed discussion about what some of the options are, and then before this legislation gets fully implemented, we have the chance to come up with something that works for our economy, for all of us as families, to get our health care costs down, and to be sure that the federal government can afford, doesn't add so much of debt and deficit to our kids and grandkids. Again, thanks a lot for your input. Keep it up, and thanks for letting me talk to you today.